Hi, my name's Layla. I'm the breast care support worker for Kettering General. My job role is mainly to support patients holistically, see what I can signpost them to, and just generally make sure that their welfare is okay and that they can come to me for support. A lot of parents didn't know where to start with talking about cancer to their children, and I just felt that this needed to be addressed. I then contacted one of the oncologists in Brighton and Sussex Hospital, and they did these book boxes for children that worked really, really well. So I ran with that with a little bit of help from them, and that's how all of these books came to life. So then I applied for charity funding, explained exactly what it is that we needed it for and why we needed it, and it was accepted. And I feel that encouraging parents to talk about their cancer diagnosis with their children brings that bond together, and it doesn't make a child quite so scared as to what's happening. I feel that if you don't tell a child what is going on, they make up their own interpretation of what is happening, and the reality is a lot less scary than what they're thinking. Some of these books don't mention the word cancer. It doesn't have anything to do with cancer. It has more of a like an anxiety and sort of connection with the patient and the child. So like I've got a book called The Invisible String, and that just helps children with what's going on in their lives, in their home lives, just to know that their mums and dads are all connected by this little invisible string. And it's just a really lovely little book, but it's not talking about cancer. And I just think sometimes that's all you need to tell children, is that they're loved and that they're involved in everything. I work with a metastatic team, so there's going to be times when parents need to talk to their children about death and dying. There's literally just one little sentence in there, and then it just moves on. Just saying that the closeness, somebody could be far away and there's still that love of that string. And I think for children, knowing that mum and dad have that bond regardless of the cancer diagnosis is really helpful. I think parents worry that they're going to put too much pressure on their children. They're just trying to encourage families that there is science behind telling children and keeping children involved, that this is where these books come into it. This is B is for breast cancer. It's very in-depth. It's by a consultant in clinical oncology in Brighton and Sussex, which is the hospital that I actually got in contact with to start all of this. It's a long book, but it tells you literally the A to Z of what could potentially happen with mum or dad. So the huge bag of worries, this doesn't start to talk about cancer either, but we know that children do tend to take on more worries than they really should. And this book basically is a lovely little book, and it starts off with a little boy. He has this massive bag of worries on his shoulder. He carries it around everywhere with him until he sits down on a bench, and an old lady comes up to him and asks what this big bag is he's carrying around. And she said, right, that worry is for mum, that worry is for dad, that worry is for your teacher. And this little bag gets smaller and smaller, which then helps children understand that really not all of their worries are their worries. I think being able to support and signpost and give patients that little bit of extra care that sometimes they might need, I think that's the best part of my job. And obviously the books wouldn't be possible if we didn't use the Northamptonshire Health Charity. Thanks to the supporters of the Northamptonshire Health Charity, we're able to provide these books to patients and their families.